On CP24 tonight, more than 100,000 cases per day. The head of Ontario's COVID-19 Science Advisory Table says he's feeling very uneasy about the rising number of cases. Plus, offering fourth doses. Starting tomorrow, Ontarians aged 60 and up will be eligible for a second booster dose as COVID-19 cases rise dramatically. And banning foreign home buyers. The federal government is set to tackle housing affordability in tomorrow's budget, making it illegal for foreign buyers to purchase residential properties here in Canada. I'm Chanel Call. This is CP24 Tonight. Ontario's COVID-19 Science Advisory Table now suggests COVID-19 case counts here in Ontario are between 100 and 120,000 cases per day. That's according to new Wastewater data, and that means roughly 5% of Ontario's population has COVID-19 right now. Dr. Peter Juni points to the transmissibility of the Omicron BA.2 variant driven by change in public behavior. And this new data comes one day before Ontario is set to expand vaccine eligibility. Starting tomorrow, Ontarians 60 and older and all Indigenous residents can receive a second booster dose. Experts saying this latest shot will benefit people at the greatest risk of hospitalization. To discuss, we welcome back to CP24 Tonight Dr. Peter Juni, Scientific Director of Ontario's COVID-19 Science Advisory Table, and Dr. Abdu Sharkawy, Infectious Diseases Specialist at University Health Network. Thanks to both of you. Dr. Juni, these latest numbers are shocking. What does this say about where we're at right now in the sixth wave and how this compares to the last wave?
Oh, we're in a completely different situation despite, these high numbers of infection than last time. Why? Because we built up a wall of immunity through a lot of third doses that went into people's arms, 7.2 million, and roughly 4.5 to 5 million people actually experienced an Omicron infection since December the 1st. Means we're in much better shape regarding our immunity, but right now we're about to overtake the peak we had during the Omicron wave. Remember, it's a numbers game, and if we have such a force of infections, this also means that the virus will find, all our vulnerable populations. Therefore, two things make sense. One is, to protect ourselves and others with masks, because that works immediately. And the other part is to go relatively rapidly with vaccination again. But we need to be aware of that. This takes from the moment you get vaccinated about 1 to 2 weeks until protection again is to be had.
So, Dr. Juni, if this continues, is the province's healthcare system prepared and ready to deal with this? Could we really ramp up to 3,000 ICU beds?
We couldn't ramp up to 3,000 ICU beds based on everything I hear, out in the field. The problem is the staff, no? We have burned out staff. We have staff who will also be knocked out by COVID right now. And, we have right now perhaps roughly 18 to 1,900 functional ICU beds. We will not be able to ramp that up, but we need to be aware of that. It will most likely not be necessary. Omicron puts more of a burden onto the hospital wards. And, because of the immunity we're experiencing already, we will not have the same risk of overwhelming the healthcare system. We did the right thing last time with quite a lot of behavior change, etc. This time we can do less, and we will still get a lot of bang for the buck if we just mask up, for example. And the point is, it will be a combination of hospital occupancy. We could perhaps again, be at 3,000 or so at the max, perhaps even a bit more. We're currently recalibrating our models, or my colleagues do, and this is complicated then by staff being knocked out because they experience COVID themselves and need to isolate.
Right. So let's talk more about this idea of masking. Dr. Sharkawy, it feels like people, are feeling a bit more casual about COVID-19 these days. How should these new numbers, this new data today from Dr. Juni, inform our behavior? Is it time to put some of those restrictions back in place?
Well, let's be clear. I think that removing the mask mandate was a mistake to begin with, because really not only was it a very visible symbol for everybody to recognize and remind themselves that we were still in the throes of a pandemic. But it really was the simplest tool that was widely accessible to everyone, really regardless of their means or privilege, to help protect themselves and those around them from transmitting this virus. So clearly it needs to be reinstituted. There has to be a sense of awareness that the simplest tools that are at our disposal need to be exercised. And I think it's really important to emphasize the point that Dr. Juni was making around the healthcare staff. You know, you can do a lot of things remotely and you can do a lot of things on a virtual basis, but you certainly can't run an ICU or an emergency room as a nurse or as a physician if you're isolating at home. And if these numbers continue to go in the trajectory that they're going for the next few weeks, that could spell real trouble for anybody who needs help in an emergency room or is critically ill. And that's something we can ill afford to invite. So regardless of whether the healthcare system can adjust in terms of the physical number of beds and the complexity of cases, we need people who are actually well enough and in good enough numbers to manage people for all their healthcare needs. And right now that's in jeopardy here.
That's a great point. Dr. Juni, are you concerned about confusion? You know, we haven't heard from Dr. Kieran Moore for more than a month now. Do we need more clear public messaging from the province about things like masking?
I would wish for that. You know, I think one of the challenges was indeed the mandate was lifted prematurely, but the next followed, which was that there wasn't consistent messaging that said, for example, okay, we're lifting the mandate, be aware of, it's a risk, but please continue to consistently wear masks. We continue to strongly recommend. What the people actually heard was basically, it's your own choice. And that's not what we need right now, especially now it's a bit paradox. In a few weeks from now, there will be spring around. People will move outside, and we will get things much better under control. So it's just about a few weeks now.
Okay, I want to ask Dr. Sharkawy about this announcement today coming from the province about this fourth dose rollout. But before we discuss fourth doses, Doctor, have enough people received their third?
No, certainly not, especially when we're talking about the under age 50 cohort, and really between the ages of 18 and 50, we've got a sizable percentage of that cohort that really needs to get the third dose. They needed it to protect themselves from the first Omicron BA1 variant. And now we have one that's even more transmissible and potentially a bit more immune evasive. So absolutely, I think that really is a point of emphasis and a target to be prioritized right now. And I think it's appropriate to be targeting the highest risk populations, those over the age of 60 and Indigenous populations as select populations for a fourth dose.
Dr. Juni, you know, I'm hearing anecdotally there's just a bit less of an appetite for a fourth dose. People seem to be a little less excited about this one than the previous doses. Can you talk about the benefits of that fourth dose and how long this protection will last?
Yeah, so first of all, really, a lot of people still need their third dose. Please go and get it, because 2 doses are not enough. This is a 3-dose vaccine. Even if you had Omicron affords only, a flimsy immunity, actually. So you need your third dose. There are still people in the 50s and 60s without the third dose. That's actually wrong, because the third dose further decreases our risk of a hospital or ICU admission 5-fold. Now, what does the fourth dose do? Based on the data we have from Israel, it brings us back to the level we were when we had the third dose, if we are about 4 months after the third dose. So the third dose is extremely important, and the fourth dose brings us back to the same protection. Remember, we have a lot of people out there now who get infected also with 3 doses because immunity is waning a bit. And by the way, it's the same for people who have had Omicron. They start to see, just themselves getting infected again now, because immunity from Omicron is also waning. So third doses, and for those at risk, really the fourth dose as well. The older you are, the more it's needed. What is important, if you get your fourth dose, protect yourself well with a really good mask.
So even if you were double vaxxed, you got Omicron, you should go get a third dose?
Absolutely, especially if you're now 2.5 to 3.5 months after the Omicron infection. Now is the time to get the third one so that you really just become well protected with a less flimsy protection than what is offered by an Omicron infection.
Dr. Sharkawy, we're also hearing about this new XC variant in the UK, and we keep talking about living with COVID. Any thoughts on what that looks like?
I think it's too early to say. Obviously, we are going to keep a very close eye on this, but I think the principle is really more important here, which is as long as we don't really put our foot down, put our our stamp on this by not allowing COVID to continue to find footholds in vulnerable populations and those that are unvaccinated, these mutations are going to arise and they're going to potentially become more problematic. So I think it speaks to the importance of making sure that we deliver as many vaccines as possible to as many populations within the community as we can, and not allow these variants to continue to spawn in different parts of the world. Until we do that, this is going to be a recurring theme, and we're not going to get to that endemic part of this pandemic that we keep talking about.
A really important conversation. We so appreciate your time. Dr. Peter Juni and Dr. Abdu Sharkawy, thank you.
Thanks a lot.
Thank you.